Bowel cancer is a general term for cancers that develop in the large bowel, which consists of the colon and the rectum. A cancer in the colon is called colon cancer, and a cancer in the rectum is called rectal cancer. Bowel cancer is also known as colorectal cancer. Bowel cancers are common, with over 40,000 new cases each year in the UK, affecting 1 in 14 men and 1 in 19 women during their lifetime. And the vast majority of cases, that is 90%, are found in people over the age of 50. Most bowel cancers arise from polyps, and these are groups of cells that form together into a small growth on the inner lining of the colon or the rectum. Cancers develop when cells lose their normal function and then start to divide and grow in an uncontrolled way or fashion. A series of genetic mutations, or changes that is, lead to cells that keep dividing, making more and more abnormal cells. Initially, these small polyps are non-cancerous, or what we call benign. However, over time, through this series of genetic changes, they can enlarge and develop into a cancer. The exact causes of bowel cancer are not known. There are, however, a number of risk factors that are recognised to increase the chance of developing a bowel cancer. Age is the most common risk factor for getting a bowel cancer, with over 90% of cases over the age of 50. Family history is another important risk factor. So if an immediate relative developed a bowel cancer under the age of 50, or there was bowel cancer in 2 or more close relatives, then your lifetime risk is higher. Also, if you've had previous polyps or family history of previous polyps, there is also an increased risk. There are 2 inherited bowel conditions, that is FAP or Lynch syndrome, that can lead to a bowel cancer. Patients with this family history would require genetic testing or counselling, and then regular surveillance from an early age. In addition, there are other conditions such as inflammatory bowel disease, namely Crohn's disease or ulcerative colitis, in which patients are at an elevated risk of bowel cancer the longer they have these diseases. For the vast majority of patients, the main risk factors are predominantly related to lifestyle choices. For instance, diet, particularly one with a high intake of red or processed meat, one which is low in fibre and lacking fruits or vegetables, are a major risk. Becoming overweight is a risk, particularly with a lack of exercise. And alcohol and smoking all seem to contribute to an increased risk of bowel cancer. With bowel cancer, some patients may either have no symptoms at all, or the very first symptoms can be very subtle and gradual. This is because symptoms tend not to arise until the cancer has reached a significant size. Small cancers on the whole are completely symptom-free. Due to the increased emphasis on screening, colon cancer is now often detected before it causes any symptoms. If someone does develop symptoms from bowel cancer, the common symptoms include a change in bowel habit, often with a tendency for looser stools and an increased frequency of going to the toilet to open your bowel. Another common symptom is rectal bleeding, and this means passing blood from the back passage, either bright red or altered when it's mixed in with the stool. There are other symptoms such as unexplained or unintentional weight loss, loss of appetite, and tiredness or malaise that can potentially point to bowel cancer. Often in these scenarios, a GP will perform blood tests which may show anemia or low blood count levels with a lack of iron. Iron deficiency anemia may suggest blood loss, which can be related to a bowel cancer. With some rectal cancers, there may be symptoms of incomplete emptying when you go to the toilet, or sometimes pain in the pelvis. Bowel cancer can also present as an emergency, and patients in this scenario complain of colicky abdominal pain or tummy pain, and this is pain which comes and goes, intensifying and then settling. They can also complain of bloating or swelling of the abdomen and not passing wind and constipation type symptoms. It is, however, important to bear in mind that many of these symptoms described can be caused by other less serious conditions, and indeed the majority of people that present with some of these symptoms do not actually turn out to have a bowel cancer. The crucial thing is acting quickly when symptoms arise and seeking urgent attention from your doctor and instituting early investigation. Because the earlier a bowel cancer is picked up, the earlier the stage or the spread of the cancer, the more likely the treatment of the bowel cancer will be curable. There are various ways in which a bowel cancer is diagnosed, and in the majority of cases we perform a colonoscopy or a flexible sigmoidoscopy. A flexible sigmoidoscopy examines the left side of the colon and the rectum, whilst a colonoscopy allows investigation of the entire colon and rectum. A colonoscopy is a fibre optic flexible camera test of the bowel and is very accurate at making a diagnosis, as it allows direct visualization of any polyps or other abnormality in the bowel, and we are able to take biopsies and pictures. The biopsies can then be analysed by a pathologist who looks at the tissue under a microscope to confirm a diagnosis. There are similar tests such as a CT colonography, which is also known as a virtual colonoscopy, that provides similar detail. However, if an abnormality is found on these, a colonoscopy is still required to get a biopsy. During a colonoscopy, any polyps identified are also routinely removed, and some of these larger polyps may contain a very early cancer. In some cases, that polyp removal may be the only treatment a patient requires, with no further requirement for surgery. But in the vast majority of patients with a bowel cancer, the affected part of the bowel needs to be removed surgically. There are other tests that are used to identify individuals at risk of having a bowel cancer, such as examining the stool for blood and blood tests. They have a role in screening populations to decide who should go forward for a definitive examination. If the diagnosis of cancer is confirmed, further investigations are required to assess the size and extent, that is, the stage or spread of a cancer. We use CT scanning to assess this stage of a bowel cancer. For rectal cancer, we use additional imaging with an MRI scan to assess the rectum in more detail, and sometimes we perform a test called an endoanal ultrasound scan. We sometimes use other forms of scanning, such as a PET scan, to assess the extent and disease activity and response to treatment. Following the diagnosis of a bowel cancer, the next step is to ascertain the stage, which essentially refers to the extent or spread of the cancer, and this will determine the most optimal treatment of that cancer. So how does a bowel cancer spread? Bowel cancer spread in three main ways. One is via lymphatic vessels to the lymph nodes. Lymph nodes are very small structures or glands that work as filters for harmful substances. They contain immune cells that help fight infection. They can also become swollen in response to infections or cancer cells. Bowel cancer can also spread via the bloodstream to other organs such as the liver or the lungs. And thirdly, they can spread within the abdominal cavity, and that is after the cancer grows through the bowel wall, thereby seeding or spreading cancer cells within the abdominal cavity onto the peritoneum, which is a lining of the abdominal cavity, or adjacent organs. After a diagnosis of bowel cancer has been confirmed, all patients are discussed in a specialised multidisciplinary or MDT meeting, and this includes surgeons, radiologists who specialise in reporting imaging such as CT scans, oncologists who specialise in chemotherapy and radiotherapy treatment, and histopathologists who specialise in examining tissue or specimens. Together, we review all the investigations to determine the most appropriate cancer treatment for each individual patient. For example, the CT scans will be reviewed to ascertain the stage or extent of a spread of cancer within the bowel, with any spread to lymph nodes, and if it has spread to any organs in the body, such as the liver or the lungs. Following this MDT meeting, a clinic appointment will be arranged to see a surgeon who will explain the treatment which has been recommended. The main treatment for bowel cancer is surgery, which usually involves removing the affected part of bowel along with the surrounding lymph nodes. Sometimes, for rectal cancers, radiotherapy is given before an operation in order to try and shrink or downstage the cancer and therefore reduce the chances of it returning. After surgery, for both colon and rectal cancers, and if there's evidence, for example, of cancer cells in the lymph nodes removed, then chemotherapy is given or recommended to try and reduce the risk of that cancer coming back.